Hi, thanks for joining today. My name is Dr. Jennifer Frustino. It's my pleasure to present for Kaleida's Healthy You. Today, I'm going to be discussing the health risks associated with the human papillomavirus, including its links to cancer. We will dive into HPV, how it's passed, how it can cause cancer, and ways to prevent infection, specifically through vaccination. A brief background. I am a Buffalo native. I received my dental degree from the University of Buffalo School of Dental Medicine and my PhD in cancer pathology and prevention from UB's Roswell Park Division. I practice dentistry and oral oncology full-time at Erie County Medical Center, which is part of Great Lakes Cancer Care Collaborative, along with Kaleida and other partners. I direct the oncology research program at ECMC and oversee our sponsored clinical trials and investigator-initiated studies. I co-chair the Western New York HPV Vaccination Coalition and the ECMC's Commission on Cancer Committee. I'm very much involved in community cancer prevention and screening outreach events. Below is a photo that we took when we were talking to Buffalo Public School Say Yes summer camps about oral health and cancer prevention. On the right is my team of dentists and specialists at ECMC, who I'm grateful to work with each and every day. So let's talk about HPV. Human papillomavirus, commonly known as HPV, is a small circular DNA virus. There have been over 120 different types discovered to date. Within those types, there are both high-risk and low-risk types, which lead to benign health conditions and cancers. HPV is the most common sexually transmitted infection. How is HPV transmitted? Humans are the only known host of this virus. The virus prefers to infect skin or mucous membranes, which is the lining of our mouth, throat, and genital tract. It is most commonly transmitted through sexual activity, specifically vaginal, anal, or oral sex. It can also be transmitted with close skin-to-skin contact. A person with HPV doesn't generally have any signs or symptoms of infection. Therefore, the infection can easily be passed from person to person without even knowing it. Most sexually active people will be infected with at least one type of HPV at some point in their lives. An estimated 79 million Americans are currently infected, with about 14 million infections new each year in the United States. Infections most commonly happen in people in their teens and early 20s. As I mentioned, there are no signs and symptoms, so most people will never even know that they've been infected with HPV. The good news is these infections will clear in about 1 to 2 years, based on our immune systems. If a person is infected with HPV and the virus is not cleared by the immune system, there may be some downstream health conditions from the infection. Genital warts are caused by HPV and can be diagnosed by a healthcare provider. Wart-like growths in the mouth and respiratory tract can also arise from HPV infection. This includes a condition known as recurrent respiratory papillomatosis that can affect children and adults with growths in the throat and the vocal cords, and they may require multiple surgeries to treat. A woman might know that she's been infected with HPV if she has an abnormal exam as part of cervical cancer screening or a diagnosis of precancer cells in her cervix. A man or woman might know that they have HPV if they have an abnormal anal exam or precancerous cells in the anus. The most concerning health problem caused by HPV, of course, is cancer. HPV causes 6 different types of cancer, including cancer of the cervix, vulva, and vagina in women, cancer of the penis in men, and in both men and women, HPV can cause cancer of the anus or the oropharynx, which is the back of the throat. How do we screen for HPV? There are currently no widely available approved screening tests for HPV infection. Most people will only discover that they have HPV if they have skin, mouth, or genital warts. A woman may learn that she's had HPV if she has an abnormal pap smear that was tested for HPV as part of cervical cancer screening. And the only approved screening test is for cervical cancer screening. Others might find out once they've been diagnosed with an HPV-related cancer. As I mentioned earlier, there are about 120 different types of HPV. There are about 80 types of HPV that affect the skin. These types of HPV cause the common hand and foot warts. Another 40 types of HPV can infect the mucosal linings of our body. The low-risk types, like HPV 6 and 11, can cause genital and mouth or throat warts. The high-risk types, most notably HPV 16 and 18, are the oncogenic types, or the ones that can cause cancer and precancer. Here are some examples of individuals with HPV infection that resulted in wart-like growths in the mouth. The photo on the left is a papilloma, or a cauliflower-like growth of the right side and the underside of the tongue. The middle photo is called a condyloma, or a wart-like growth of the lips. The top right photo is of a papilloma, or a wart on the underside of the tongue. Fortunately, these conditions are benign and treatable with minor surgery or other procedures. However, they can be troublesome if they reoccur. How does HPV cause cancer? When the infection lingers and is not cleared by our immune system, the virus proteins actually inactivate two critical tumor suppressor genes. These genes are known as the p53 gene and the retinoblastoma gene. When these suppressor genes are inactivated, it disrupts the cell cycle, leading to tumor growth. This may take several years or even decades. There's no way to know who will go on to develop cancer and who will not. We do know people who are immunocompromised or immunosuppressed for a variety of reasons, whether it's from infections like HIV or using certain types of medications, tend to develop these cancers more frequently. Locally in New York State, about 2,800 people are diagnosed with an HPV-related cancer each year. Cervical cancer is the most common for women, and oropharyngeal cancer is the most common in men. The media has been creating awareness about HPV and its link to cancer. Actress Marcia Cross said that her anal cancer diagnosis was linked to HPV and her husband's throat cancer. Actor Michael Douglas blamed his throat cancer on HPV from oral sex. Marcia Cross is now the co-founder and president of the HPV Cancers Alliance, an organization designed to spread knowledge and save lives. Let's focus briefly on HPV-related oropharyngeal cancer. This cancer is on the rise. This is when the cancer is present in the base of the tongue, the tonsils, or the pharyngeal walls or the back walls of the throat. The number of HPV-related throat cancers among men has more than doubled in the last 20 years. There is now an epidemic of HPV-related throat cancers. This is affecting younger patients without a history of heavy alcohol or tobacco use. Alcohol and tobacco were traditionally the most common risk factors for head and neck cancer. Now we're moving toward HPV as the cause of oropharyngeal cancer, with over 70% of oropharyngeal cancers linked to HPV. What are some of the signs and symptoms of oropharyngeal cancer? Any of these symptoms should prompt a visit to your healthcare provider or specialist, especially if they don't resolve in about 2 weeks' time. A sore throat, ear pain, a lump in the neck on one or both sides of the neck that doesn't go away, any pain or difficulty swallowing, feeling like something is stuck in the throat, changes in the voice or speech, or unintentional weight loss. Here you can see a photo of a lump in the left neck. This is often the first sign that there may be an issue of throat cancer. Throat cancer tends to metastasize or spread to the lymph nodes in the neck in this area. There is no treatment for the HPV virus. There are treatments for the health problems it causes. Warts can go away with treatment from a healthcare provider or prescription medications. Cervical precancer is also treatable so that it can prevent development into cancer. Other HPV-related cancers are more treatable when detected early. Typically, cancers are treated with surgery, chemotherapy, radiation therapy, immunotherapy, or a combination of these modalities. Fortunately, when it comes to HPV, we can prevent infection, and that's through vaccination. The HPV vaccine is for cancer prevention. We can prevent future generations from developing these HPV-related cancers by vaccinating our young people. The vaccine is safe and effective. It actually produces higher level of antibodies than a natural HPV infection. This vaccine, however, is for prevention. It's not for treatment. It needs to be given before the first sexual encounter to be most effective. Boys and girls can get the vaccine starting as early as age 9. Currently, the vaccine is given around ages 11 or 12. Everyone through age 26 should get vaccinated if they have not already been vaccinated. Some adults aged 27 to 45 who didn't already get vaccinated may decide to get this vaccine after speaking with their healthcare provider. At this age range, we know the vaccine provides less benefit because most sexually active adults have already been exposed to HPV. Ages 9 through 14 require 2 doses of this vaccine. After age 15, 3 doses are required. It's best to start talking early about HPV vaccination, especially around ages 9 to 10. Parents may have some concerns. Here are some frequently asked questions. Why does my child need an HPV vaccine? The answer, HPV vaccination is important because it prevents cancer. Is my child really at risk for HPV? HPV is very common and widespread, and it infects both males and females. So yes, your child is at risk for developing HPV as they grow up. Why at age 11 or 12 years old? Remember, this is a prevention vaccine. We can equate this to wearing a bike helmet. When would a child put on a helmet? Before they get on the bike. Not after they're riding their bike in the street, not when they see a car heading at them, and not when there's been a crash. The vaccine needs to be given before the sexual debut. What are other ways to prevent HPV? Talk to your healthcare provider or pharmacist about getting an HPV vaccine. If you are sexually active, use condoms the right way every time you have sex. This can lower your chances, but HPV can still infect the skin on the areas the condom does not cover. Being in a mutually monogamous relationship will also lower your chances of getting HPV. And of course, see your healthcare provider for cancer screenings. Thank you so much for your time today. I hope you learned something about HPV, its link to cancer, and how to prevent it through vaccination. We will in time reduce the cancer burden. Please feel free to email me if you would like any additional information, resources, or have any questions. Thanks so much.